Hi, I'm Ellie and I'm a psychological wellbeing practitioner at Private Therapy Clinic. And in this video today, I'm going to talk about eating disorders. In particular, differentiating between disordered eating behaviours and eating disorders before going on to talk about some of the common categories of eating disorders that I'm sure many people will be really familiar with, as well as some of the lesser known categories. Following this, I'm going to talk about myths. So with eating difficulties, there are a lot of myths which not only act as barriers for people reaching out professionally for support, but also to their family and friends. And finally, I'll talk about treatment, so identifying what the treatment for eating disorders are, and specifically a bit more information about the different stages in this treatment. So what is an eating disorder and how is it different from disordered eating? Disordered eating refers to a range of abnormal behaviours that many people will engage in as a way of maintaining their weight and shape. For example, dieting, over-exercise, even binge eating. These are all disordered eating behaviours and they lie on a continuum. And when it becomes an eating disorder, it's when the severity and frequency of these behaviours change. And in particular, when there's a negative impact on the individual's mental and physical health. For example, dieting as a way of maintaining your weight isn't an eating disorder. However, severely restricting your food intake to the point of malnourishment and fatigue is an eating disorder. So that's the key difference between disordered eating and eating disorders. And I'm sure many of you will be aware of some of the three key eating disorder categories. So these are anorexia nervosa, bulimia nervosa, and binge eating disorder. And I'll just go and talk about these into a little bit more detail. So as I previously mentioned, eating disorders fit along a spectrum of eating behaviours, and there are some behaviours that are quite common between the different eating disorder categories and some that are very different, and that's what really differentiates the different categories. Something that's quite common between eating disorders is an over-evaluation of weight and shape. What I mean by this is when asked to value yourself as a person, an individual with an eating disorder will put a great emphasis on their weight and shape as their value as a person compared to someone without an eating disorder. So one way we could visualise this is if we asked two people to create a pie chart. One of the individuals didn't have an eating disorder and one of them did. The individual without an eating disorder, their pie chart will be very colourful, lots of different categories that make them them. So their career, their education, their relationships, their personality will fit the pie chart as their value as a person. An individual with the eating disorder will put the great emphasis on weight and shape, and in fact their pie chart might just only have that on it, or there might be a few other categories, but a big proportion will be taken up by their weight and shape. Something that goes hand in hand with this notion is a preoccupation with weight and shape. So most individuals with eating disorders will have this preoccupation, constantly thinking about restricting, constantly worried about weight gain, constantly worried about binging and purging, all these different things. As I mentioned, there are three main categories of eating disorder. Firstly, we have anorexia nervosa. So this is the category that I think most people think of when they think of an eating disorder. They think of someone who's severely underweight and they don't eat much and they're constantly restricting. And that is what anorexia is. It's categorized by that intense fear of weight gain and constant need to restrict their food intake. They will present with an underweight BMI and look very thin, and also have a cognitive distortion with the way that they look. So what I mean by that is, despite being malnourished and very underweight, they will think that other people see them as larger, or they will see themselves as larger. So that's what anorexia is. Bulimia nervosa is really categorized by episodes of binging and purging. So what I mean by binging is not just eating an extra slice of toast in the morning or having a few more biscuits. It's an objectively large amount of food, and it's associated with a lack of control when eating. So eating until the point that you're past full, you're just binging that food, and as a result they will then compensate for that behaviour. So they might self-induce vomiting, over-exercise, use of laxatives. So it's really a binge-purge cycle when bulimia. And people with bulimia may even present with a normal BMI and maintain a steady weight because of their binging and purging behaviours. And finally, binge eating disorder. So binge eating disorder is categorized by regular episodes of binging, which isn't followed by purging, unlike bulimia. So they will eat an objectively large amount of food, and it will be associated with a real lack of control and guilt and shame. So those are the three common eating disorder categories. So most people will be familiar with those three categories I previously discussed, anorexia, bulimia, and binge eating disorder. But there are in fact other eating disorder categories that a lot of people may not know about. One of these being other specified feeding and eating disorders, or OSFED. And what this is, it's when a person may identify or present with a lot of symptoms of one eating disorder, but they don't fully meet the criteria for example, of anorexia. An individual might present with an intense fear of weight gain, constant restriction, and that cognitive distortion that we spoke about. However, they're not at a low weight, or they're maintaining a relatively stable BMI. They wouldn't meet the diagnosis or the threshold for anorexia, but they do have an eating disorder, and this would be OSFED atypical anorexia. This doesn't mean that their eating disorder difficulties are less serious than other eating disorders, but recognise that presentations with eating disorders are really different between everyone, and that just because you don't reach a threshold or criteria doesn't mean that you don't deserve that support. Another eating disorder that I think not many people might know of is called pica. So pica is categorised by eating non-nutritional food, for example, chalk or paper. So an individual will seek these food sources which don't actually give them any nutrients. Another eating disorder category that, again, people might not be aware of is avoidant restrictive food intake disorder. And this is really associated with fear of food or avoiding certain foods because of the texture or sensory characteristics and smells, and really just a lack of interest in food in general. So now that we've covered what an eating disorder is and how it differentiates from disordered eating, and we've gone through the different categories of eating disorders, I thought it would be helpful to talk about some of the key myths or misconceptions of eating disorders. So what I mean by this is, I think a lot of people have knowledge on eating disorders, in particular the three most common, but they also come with common misconceptions. So people think, for example, they only affect women, and that's not the case. And these really act as barriers for people reaching out for support, not only professionally, but also from their friends and family, because they just don't think that what they're experiencing is an eating disorder. One key myth is that eating disorders are a choice, and that's definitely not the case. There's no single cause of eating disorders. Research shows that there could be biological factors, but there's also external factors that really contribute to the onset of eating difficulties, and that they're definitely not a choice. The second is that, as I previously mentioned, I think when people think of eating disorders, they usually go to anorexia or underweight, but they also might usually only think of women. Women between aged 12 and 20 can only get eating disorders, and that's definitely not the case. While it is common for onset to occur in women aged 12 to 20, it can occur throughout the lifetime, and it also can affect men. And a lot of men more recently are reaching out to get support for eating disorder difficulties now that they're recognising that this is actually a misconception. Something else that I've experienced is a lot of people don't think that they are ill enough to get some treatment. And with eating disorders, early intervention is actually really helpful. But because they aren't presenting with that underweight BMI, or they're binging a few times a week but not quite to the severity, they think, oh, I'm just not ill enough to get support, and that's definitely not the case. Any eating difficulty that you are experiencing, it's definitely worth getting some support for. Sort of going hand in hand with this, a lot of people think, I just live with it, eating disorders are for life. And again, eating disorders cause harm both to the physical and emotional health of someone. So while they are serious mental health difficulties, they are treatable. And a lot of people who engage with treatment and go through the treatment are able to get a full recovery from their eating difficulties. And finally, something I wanted to talk about was that binge eating is just overeating. And as I mentioned before, it's not a case of just a few extra bits of toast or a couple more biscuits. It's an objectively large amount of food, and it's really associated with a loss of control. It's not just eating that I know I'm overeating, it's I can't stop myself eating. So there's some of the key myths and misconceptions of eating disorders that really stop people reaching out for support. So the final thing I wanted to talk about was the treatment and a whistle-stop tour of what the treatment is. So according to the National Institute for Healthcare and Excellence, the leading treatment for eating disorders is enhanced cognitive behavioural therapy. So CBT is used to treat a range of mental health difficulties by focusing on the here and now and identifying unhelpful patterns of thinking and break that cycle, and provide some coping strategies for the individuals. And that's exactly what it is for eating disorders as well. So CBTE is used to treat all eating disorders because they've got those common behaviours between them, and it focuses on the cognitive processes that are at play as well as what's maintaining the eating disorder. And it's tailored for each individual's unique experiences, focusing on their beliefs but also external factors and triggers that might have brought on the onset. There are a number of different stages to this treatment, and the first is really to gain an insight into the individual's experiences and difficulties and provide some education about what they're experiencing. And then next will be a review of the progress that's been made and identify what some barriers might be moving forward. And the key part of the treatment is the third stage, and this is addressing and modifying processes that are maintaining the eating difficulties. So it'll be quite a lengthy bit of stage 3. And finally, it's focusing on how can we maintain these positive changes post-treatment. So that's a whistle-stop tour of the treatment for eating disorders. Thank you so much for watching.